Hi everyone, this is Dr. Mike Majmundar with Northside Plastic Surgery here in Atlanta, and today we're talking a little bit about Ultherapy. Ultherapy is a skin tightening device that allows us to tighten skin in the face, jawline, neck, brow, around the eyes, and around the mouth. Currently in the market, there are 3 different modalities used for skin tightening. That's infrared technology, radio frequency technology, and then ultrasound technology, which is what Ultherapy is. Infrared technology doesn't really do a whole lot for most people, so that's pretty much been abandoned and not very many people use that technology anymore. Radio frequency skin tightening is still very popular. Those are devices like Thermage or Excellis that are used over the skin, and they're using a wand to deliver heat over the skin while it's moving. It works fine, however, it's limited by the fact that the heat has to traverse through the skin, so it can't get too hot, otherwise it can burn the skin. So ultrasound energy is very nice because ultrasound energy used in Ultherapy is something that delivers the heat deep down below the skin, and it helps produce collagen and tightening in the same layer of the tissue that we tighten during a facelift. So if you've ever seen somebody get an ultrasound for a baby, then you know that the ultrasound waves can bypass the skin and go through the skin and go down to the tissue it needs to get to, and still show an image without creating any kind of damage to the skin overlying it. This is kind of the same idea. The ultrasound waves can bypass the skin and go down deep and create collagen and tightening in the same layer that we tighten during a facelift or a neck lift or a brow lift, and to give you some improvement. Now, Ultherapy is not a facelift. It is not a surgical brow lift. It is not a neck lift. However, it does give you some improvement, usually about 25 to 30% of what you would get with a surgical result. It takes 1 session. And for a lot of people, if I tell them, hey, you can get about a 30% improvement with a 1-hour procedure with no downtime, they get really excited about that. And so that's really for individuals who are looking for that type of improvement. The biggest limitation to Ultherapy has to do with individuals who are aging a few different ways. So if you have loose skin that you want to tighten, but you also have volume loss, then you really need to address the volume loss in order to see the visible changes from the Ultherapy. Meaning, if you are thin and you're trying to treat your jawline and you have volume loss along the jaw, if you only do Ultherapy, yeah, you'll get some improvement, but it may not be as much as you're expecting it to be, primarily because you haven't addressed the other way you're aging, which may be volume loss. So you want to add the volume in, and maybe filler, maybe an implant, maybe fat injections, but you want to talk to somebody who does that as well as Ultherapy to give you the best advice in terms of what the best result would be for you.